Well, this is Power Breakfast on Citizen TV. Thanks for staying with us. Very important day today. 29th of September is World Heart Day, and we are celebrating it here in Kenya as well as around the world. I've got some guests in studio who are going to tell us more about some of the activities planned today and what that day means for us all. So Dr. Anders Baraza is part of the Kenya Cardiac Society. Welcome.
Morning.
Good morning. And Elizabeth Gatumia, CEO of the Kenya Heart Foundation.
Kenyan Heart Foundation.
Okay, all right. Thanks for being with us. I understand that both organizations have teamed up with the Ministry of Health for a very important event today, and we'll talk about that in a minute. I just want to establish what World Heart Day is on a global scale. Who wants to tell me what it's all about?
I can say just a few words. So World Heart Day is really about creating awareness about matters of the heart, cardiovascular diseases that are on the rise in all parts of the world outside the Western world, and especially in the African continent. So we're trying to raise awareness and get people to understand that symptoms has to lead to you looking for some kind of health authority to help you out or referral to a doctor. So it's just really getting the people who have symptoms of cardiovascular diseases to seek help.
Okay. All right, Elizabeth, I see your T-shirt there says "Share the Power."
Yeah, share the power.
That's the theme for this year?
Yes, it is the theme for this year. And the whole idea is to sensitize people, the public, to create awareness. And as we all know now, I mean, heart diseases have become a serious concern, even in African countries. Before, it wasn't happening. When we're eating our own natural foods and, you know, and being busy, going to the shambas and digging and all that, it wasn't as bad. But now we have borrowed everything, the good, the bad, and the ugly, from the West. And so people are beginning to get obese. They're beginning to get those diseases because of the very bad feeding. Fast foods are not helping our lives. And so it's for that reason that World Heart Day was formed, so that on a global level, people can be sensitized that indeed they can prevent themselves from getting the heart diseases.
Right, and there's quite a few organizations involved in what is happening here in Kenya. So maybe we can differentiate the Kenya Cardiac Society from the Kenyan Heart Foundation and tell us what...
So the Kenya Cardiac Society is actually the associations for health personnel who are interested in promoting heart health. So it's nurses, any health personnel, physicians, cardiologists, a non-profit organization that is just really trying to engage with the ministry, which we're already doing, to promote policies that will help people seek help, to help the cardiac health of the country, so to speak. And I think the main thing here is really the shift from communicable diseases, that means infections, TB, HIV, to the more chronic diseases, the cardiovascular diseases, hypertension, diabetes is part of the non-communicable diseases, but it's also a part of the disease spectrum that leads to a lot of cardiac diseases. So hypertension, strokes, and heart attacks are really one of the major diseases. So we're pushing that agenda as professionals.
Right. Elizabeth?
Yeah, and the foundations are... okay, let me just look at it again from why did we come on board. These are doctors, I mean, and they're medical people, cardiologists and the staff that work with the nurses and all that. These are scientific medical people. But we come in as communicators. We are in advocacy. We come as foundations. We come to create awareness. They will tell us now this is what is happening, for instance, in the country. One of the biggest concerns that I never like to leave a show without mentioning, for instance, rheumatic heart disease, a disease that affects children in Africa a lot and in other developing countries. And it is a disease that is totally 100% preventable. So when they tell us that now they have seen the increase in their research and all that in rheumatic heart disease in children, many children are dying, and you know, of course, open heart surgery is very, expensive. It's unaffordable for most of us, even as we are sitting here. If you're told to cough $500,000 plus 1.5 million shillings, it's quite expensive. So we come in to explain to people, yes, you can prevent rheumatic heart disease. So we address the people who are concerned. And who are these? because rheumatic heart disease affects children mainly, between about 5 to 15 years, up to 18. So we will address the children themselves. So our programs go to the children, to the schools and all that, churches and all. And we also address the parents and anyone else who listens, any minder of any children, wherever you can find them. So the idea, again, going back to the World Heart Day, is that it is about creating a global awareness that we can do something about the heart diseases.
Right, and I understand that, one of the first, steps in tackling heart disease is knowing your risk and understanding some of the risk factors. So, Dr. Barasa, maybe you could talk about that.
Yeah, I think risk factors in the context of Kenya is very interesting because they've changed so fast, so rapidly over the last 20 years. So sedentary lifestyles used to be quite rare, very common now. Probably one of the biggest risk factors. Another risk factor is the way we eat, of course. We seem to have a problem with controlling the amount of calories that we're eating in the country. Once we reach a comfortable level financially, we tend to eat more than we're supposed to. Or maybe it's that shift that's been so dramatic that we now actually have 13% of children who are overweight in Nairobi. We have, if you look at overweight generally, we have a double epidemic. We have parts of the country that are undernutritioned, yet in Nairobi we have a very big problem with overnutrition. So diet really and sedentary lifestyles are the main things. There's been a lot of discussion about how you should eat and what you should eat, but the main thing is really be active, have a generally active lifestyle, meaning take the stairs instead of the lift. Do all those things in your everyday life instead of focusing on going to the gym twice a week. Just be an active person generally and watch your calories and understand where your calories are coming from.
Yeah. So one of the questions I'm sure people watching might have is, what is the government doing you've talked about this being preventable, a lot of these diseases being preventable, especially among children. How involved is the government in, educating and making sure that, they're reducing deaths and disease from cardiovascular disease particularly?
That's a good question. And when you think about the Ministry of Health, it has more than it can chew. I mean, it has so many things to deal with.
Right.
And most of the times, basically what we do ourselves, especially as the foundation and even the cardiologists, it's like you look, across the fence and you find that your neighbor's garden is having a lot of weeds and it disturbs you. And so you go to that neighbor's place and you start digging for them, helping. That is not our area. Right. But because we have seen that they can
the Ministry of Health is involved in
exactly. They are very involved. So what we do, we bring them. I mean, of course, we are in their field. We shouldn't be dealing with this at all, actually. But because we know they're overwhelmed, and this is our country, these are our people, we need to know that if they are overwhelmed, and they say it, in fact, that they cannot cope with what the expectations regarding health.
Just quickly, I want to talk about the event itself, because I know it's taking place at the Nairobi Railways Club grounds. Can you maybe talk about some of the activities, what time it's starting? I know Honorable Mike Sonko will be one of the guests there. So can you tell us a little bit more about what's happening today, tomorrow?
Yeah, definitely. But just before I get there, let me just say this. A question was asked to me that the people are already aware that there are other heart foundations in this country, which is a good thing. I mean, the more the better. I mean, if you can go and address the issues of heart disease, and all of us are trying to help people live a healthy lifestyle, it's a good thing. But the difference between, let's say, Kenya Cardiac Society and Kenyan Heart National Foundation is that we are national bodies, and at the same time, we are members of the World Heart Federation, which is a global body. So when World Heart Federation wants to communicate to Kenya on any matters scientific, that have to do with heart health, they go to the Kenya Cardiac Society because they're the members. When they want on advocacy, they will come to us. Okay. So the others, they are there and they do their thing, whichever way they do.
You short because we're running short on time.
Now, about the event, it is going to be very exciting. We have a walk. We normally do a walk, a 5-kilometer walk. Again, he talked about physical activity.
Yes.
That's one of the really important things to keep your heart healthy. And he did mention about the smoking. Smoking is very bad for heart. So the good nutrition is also very good. So there's a walk. Then after we do the walk, we'll also do some Zumba dancing.
Okay.
Again, it's
fun.
Remember, we talked about sharing the power.
Yeah.
It is showing, it's really encouraging people to keep active. One of the things that they've said, and I think this is important, is that one of our biggest killers is not even the cigarettes that are bad for our health or bad food, junk food and all that. The biggest thing is this. It's the chair that we sit on.
Yeah.
So that sitting needs to be reduced. That even us who are in the offices, just walk around, stretch and do whatever, so that you're not sitting too long. So back to the venue again. So we also have children who are going to come and recite poems on rheumatic heart disease. They also have a skit they are going to do.
Is this event open to the public?
It is. We are there. Yeah, anybody who wishes to come.
This event is for the public. And,
it is actually.
We also have health screening, which is something that has been going on every year. So come and have your blood pressure taken. We'll even do blood sugars and just do a general health screening with physicians there.
No
and
charge.
Remember that no charge, free screening. And remember that this is not just happening in Nairobi. It's currently happening in Mombasa, Garissa, Eldoret. I think we have some few other cities. So we have 5 or 6 cities running concurrently this year. We do this every year, and this year we just try to bring a bit more of a splash.
Right. So what time can people start arriving at particularly in Nairobi at the railways?
No, they're there already.
They're already there.
Okay. We were starting at 7:30. We expect our guest of honor to come probably around 9, so we should be finding our way there before he does.
Okay.
And again, even inviting the governor himself, it's to show the importance of the event. So that, and again, because most of these diseases, as you would know, affect a lot of the slum areas for various reasons, as we would understand. They are predisposed because of their very nature. You know, the poor sanitation, poor feeding habits, overcrowding and all that. So those are some of the things we address, knowing that they are limited in their finances, but we try and show them that they can still live under those circumstances, but you know, improve upon whatever they have.
Well, it's a great event that you guys are putting on, and I'm glad that these organizations have gotten involved. We have been talking about World Heart Day 2017. It's being celebrated all across Kenya, which is something to be proud of.
And the world.
So, yes, and the world, of course. But, you know, it's important for Kenyans watching to know that there are areas that they can go today and learn more. Thank you both for being here.
It's one more thing.
We're
that's
just
very
out
important.
of time.
It's the showstopper. This evening, we are going to Britam building. We are going to light it up right at the top as part of the creating awareness. So for all the viewers who are listening, wherever they are, let them look out, especially the ones in Nairobi. It is sponsored by Britam, and it's going to be late just as part of the celebration.
All right.
To create awareness.
Thank you so much. Of course, stay tuned to Power Breakfast. We do have DJ T-Boy yet to come with the Level Up Fridays. That's the hashtag to use.